Hi, I'm Dr. Steve Krause. 38 years as a licensed DC. I've owned 19 different chiropractic practices and helped buy and sell over 410 clinics across the USA in a 12-year span. Today, we have some great insights and training for you. If you're a chiropractor and your patients aren't committing to care, this is the likely reason. It's not your treatment, it's not your technique. It's something I call the diagnosis gap. I've seen this across the 19 clinics that I've owned and scaled. The gap between what you know clinically and what the patient actually understands. This is what determines whether they commit to care or not. I will now walk you through a real world report of findings, exactly how I would explain it in a case to a patient, step by step. We're going to use the history, the mechanism of injury, the examination findings, the radiographic images, and the diagnosis. It leads up to the care plan recommendations. And then I'll show you how this ties directly into practice growth and retention. So let's get started. Hi, Mrs. Jones. Based on everything you've told me and what you're experiencing, the neck pain, the headaches that start in the upper neck and travel into the right side of the back of your head, the tingling that you described to me yesterday in the examination, how it goes down your right arm into your hand and it affects the ring and little finger, and that difficulty you've had sleeping because of all of this neck pain and the worsening when you get in certain different positions and you just can't sleep comfortably. And you also confirmed that these symptoms started right after your car collision, the next day and the same day. And when you described to me how the car was rear-ended at about 15 miles an hour, and then right before the impact, you said you turned and looked up at the rear view mirror because you heard the skid marks of the car behind you. Now, that specific detail of your head being turned to the right is very important because when your head is turned and your head and body are suddenly accelerated forward and then backwards in that whiplash mechanism, it creates a very specific type of biomechanical stress on the neck and the joints of your spine, because that motion can overstretch and injure the ligaments that hold each of the vertebrae together. As we show you here on this spine model, there are joints, and each of these joints between each of the vertebrae have ligaments holding them together. Well, that injury compressed and injured these vertebral joints. We call them the facet joints, and they're between each vertebrae, which allow you to move your neck and rotate. And this mechanism of injury created imbalanced loading on the nerves that come out between each of these vertebrae. And then you have smaller nerves on the joint capsules, on those ligaments. And because that rear end mechanism impacted you right as you had your head rotated to the right, well, that actually explains why many of your symptoms are primarily on the right side, because as you can see here, with those vertebrae rotated to the right, it compresses those nerve roots coming out and it wedges those nerve roots and joints when that hyperextension occurred as a result of the impact, further impacting and bruising those nerves. So when I examined you yesterday, I found several objective findings. You might recall when we were palpating your muscles and your neck that you had a significant muscle spasm and tightening of the upper neck muscles at the base of your skull. And you were really tender on palpation. And that algometer device, that pressure gauge that I was pressing alongside your spine, it measured a much higher sensitivity and more tenderness on that right side. Do you recall that? Yes. So in addition to that sensitivity, you also had decreased range of motion in your neck. We measured it with our inclinometers, and you had decreased rotation to the left, your right lateral bending, and your flexion. All three of those ranges were 40% less than normal. And that's significant. And it's because of how the vertebrae are rotated. And we documented all of these changes along with your sensation deficits along the ulnar nerve. And that nerve root comes out right at the C7 level, and it goes down to your ring finger and the little finger. And the pinwheel test that we did showed that you had less sensitivity. And the reflex that we did on the wrist extension showed that that was diminished as well. And all of those point to this lower cervical vertebrae here on your neck. So together we've got your history, the mechanism of how that injury occurred, your orthopedic and neurological exam findings, including the range of motion tests and those nerve tests. They're all pointing to the same direction, the causation of your injuries. It's much more clear now. So what I'd like to do is show you how this all correlates with your x-rays, and your x-rays confirm these findings. So let's look at the radiographic image on flexion, because this is where things become even more clear. On flexion, those joints aren't gliding all the way forward. There is an actual slippage here that we can see, which shows that there's a ligament injury. And then on your oblique views, if you recall, that's where I had you turn your body and your neck 45 degrees so we can see the opening or the holes called the intervertebral foramen right here on the x-ray on the computer screen. It shows how this space is where the nerve root exits out between that C7 vertebrae, and that just happens to be the nerve that goes down into that right side of your hand, into those two fingers. So this nerve root, just so you're aware, is as thick as a pencil. So we're not talking about microscopic nerves like we are on the facet joint that we explained earlier. This nerve root is large when it comes out right off of the spinal cord down between the two vertebrae and down the arm. And that's why the tingling that you're experiencing and that decreased reflex that we graded, that's because of this compression, and we call that a radiculopathy. Now, in addition to that, on this other view, this front view, it shows that your C5, C6, and C7 vertebrae are all rotated to the right. And part of that is because of the way your head was turned at the impact, causing that hyperextension and hyperflexion. And that's also why you've got this restricted motion and you don't have the full flexion or the full rotation, because these joints aren't gliding smoothly. So here's what we have. We have structural findings, vertebral misalignments. That matches up with our exam findings. And then the mechanism of the injury, how you were positioned at the time of that impact, all of that comes together. So Mrs. Jones, your diagnosis is the following. You've got cervicogenic headaches, meaning these headaches are coming from the upper neck, radiating into the back of the skull area, because those nerves and muscles are all tightened and impacted from this injury. And then this area that goes to the back of your skull, those nerves supply the muscles on the back of the head, and that tension creates these tension and cervicogenic type headaches, facet syndrome. And these are the joints of your upper neck vertebrae and your lower vertebrae that have been impacted, and they have a grade 2 sprain. So on top of that, the nerve root compression and irritation of the C7 area has caused a radiculopathy. It's created the neurological tingling and the symptoms down your arm. So all of this is mechanically connected. This is not random symptoms just happening. It all makes sense, and it adds up to why you're not sleeping comfortably. You've got multiple areas of injury: the nerve, the joints, the ligament, and then you add that muscle spasm and tension in the upper neck with the headaches. It's no wonder why you can't get comfortable trying to sleep at night. But Mrs. Jones, this is the most important part. Because everything matches up, your history of the accident, the position your head was in, all of our exam findings, the range of motion, the nerve tests, And finally, the radiographic images all confirm and point to the same set of diagnoses. Now that we know for certain we have an accurate diagnosis, we can apply an effective treatment plan to help you get the best outcome and a full recovery. Now, the good news is this: conditions like yours respond very well to chiropractic adjustments and therapies. There was actually a recent large research review of all the studies on headaches, specifically cervicogenic headaches and tension headaches. And this study was done by Traeger just last year in 2025. And there were 57 researchers who looked at over hundreds of studies, but they picked the best 30 studies for the same kind of headaches that you've been having. And what they found was that chiropractic adjustments and soft tissue therapies together had about a 92% improvement rate in cases like yours. Now, that doesn't mean everybody was cured, but they all had significant improvement. 92% of them did. And in my own clinical experience, working with hundreds and hundreds of cases like yours, I've also found that 8 out of 10, 9 out of 10 see excellent recovery. So you're in good hands. We're going to be able to help you significantly. But I want to be very clear with you. Because this was a rear end collision with a whiplash type injury, and you have some additional risk factors present that the scientific literature shows might not give a full 100% recovery. And so what those risk factors are was that your head was rotated, it was a rear end collision, you're over the age of 55, and you're a smaller female frame, and you have the radiculopathy. You take all of those and combine them together, those risk factors do indicate you have a higher chance of having chronicity from this injury, meaning chronic symptoms that might last into the future. Now, it's about a 50-50. Half of them fully recover, and the other half still have some chronic long-term residuals. So the main reason why some of that chronicity develops is because they didn't get enough treatment at the beginning of the care, especially in the first few weeks. So the good news is you're here within 2 days of the accident. So we can get started and implement the right care plan, because our goal is to give you the best possible outcome. We want a full recovery, and it is definitely possible, especially since we're addressing this early and we're going to apply the correct treatment with this accurate diagnosis. So here's how we're going to do that. We're going to begin with a focused initial phase of care. Over the next 8 weeks, we're going to be performing chiropractic adjustments, therapies for the soft tissue injuries, and to help repair those ligaments and muscles. And we're going to be prescribing neck stabilization exercises. So we'll reevaluate your case in 3 to 4 weeks from now, and then we'll do a second reevaluation at the end of the 8 weeks. And at that time, we'll make a determination how much further care might be necessary depending on your progress. But this early care is critical. The first 6 to 8 weeks is what helps prevent scar tissue of a significant level from developing in those ligaments that were injured. We want to restore the alignment of these vertebrae so that the joints aren't misaligned, and that's what causes some of the scar tissue, because the tissue is still stressed or rotated. And in order to prevent that scar tissue from forming improperly on those injured ligaments, you need to know that scar tissue is less elastic, it's weaker, and it's less stable. And that's what makes the neck or the spine more susceptible to re-injury or to flare-ups. That's how we need to prevent the chronicity from developing. We've got to repair that properly. So each visit that we have, it builds on the last visit. So this is not a one-visit solution, because I've seen this happen before. Some people get better, they get 80% better, and then that last 20% they don't follow through because they just assume it'll get better on its own. Well, they didn't do it the right way, and they didn't get a full recovery. I can't emphasize this enough to you, that all the research studies show that Half the people in a car crash of this nature have lingering effects. They have that chronicity 2 years and longer after the date of the injury. And a lot of that reason is because they never received enough treatment up front, or they let it go when they were on third base or 80% recovered. They never saw it all the way through. They just assumed that that remaining mild to moderate pain would just go away on its own. And it didn't because of improper healing. It healed with the scar tissue, and that can be permanent. So I know what we need to do. We just need to follow through with it and see it all the way through. So showing up for your appointments is critical. And in the beginning, we're going to need to do this daily for the first 2 weeks. And then we'll go to 3 times a week for the next 4 weeks. And then we'll taper it back to twice a week. It's the difference between having a successful outcome and an unsuccessful outcome. Now, Mrs. Jones, I'm going to send you your x-rays via text or email, whichever you prefer, because these x-rays that we've gone over with you, I've circled and highlighted the key areas, and I want you to keep this as a reminder so you know exactly what we're working on. And if you'd like to show these images to your family or your spouse so that they understand what's going on, I think that's important, because when they can see it and you see it, it makes a lot more sense what we're trying to accomplish here, to restore that alignment and heal those tissues, to try to prevent chronicity and long-term residuals from developing. We want to get a good outcome here. So to summarize this all up, we've identified the problems, we've determined an accurate set of diagnoses for each of these conditions, and we've confirmed the causation, why they happened because of this whiplash injury, and we've matched it up with your symptoms and the nature of the mechanical injury on the mechanics of how it occurred. So because of all that, we've now got a customized treatment plan that I've designed for you. I'm going to have Betty come in and go over that plan with you to get you scheduled in advance so that we can make sure we get the proper care. And all of this is supported by the scientific research and my clinical experience in getting a full resolution. But again, the key is we've got to follow through with it. Doctors, let's step out of the patient conversation for just a second here, because this is where most chiropractors lose the case. There are two versions of every diagnosis: what the doctor knows and what the patient understands. And if these don't match up, you have what I call the diagnosis gap. And that gap is what kills retention. It kills compliance, which prevents a better outcome, and it kills practice growth. Patients rarely drop off because of the price, especially in PI cases. They drop off because they don't fully understand the seriousness of their condition. They don't understand what's wrong or why it matters and what happens if they ignore it and don't follow through. This confusion creates a hesitation in the patient, but clarity creates commitment. If you want to close the diagnosis gap, use clear, confident language. Tie the history, the exam, the imaging, the final diagnosis, tie it all together and show them. Don't just tell. Use visual reinforcement. Use the radiographs. Use spine models. Use graphical diagrams or illustrations, and give a realistic expectation of their outcome backed by scientific literature. And most importantly, make everything match up. Now, of course, there are going to be cases that you don't have all the answers, and there's going to be cases that are not crystal clear. But in the reality, that's your top 10, at worst, 20% of the cases. So in those cases, lay out the objectives and the goals and the differential diagnosis, and explain why there might not be a definitive diagnosis because of the complicating factors that might be present. And most likely, even the two differential diagnoses, chiropractic can probably help with both of those. And in either case, it's still a good expectation for many of those cases. But in the 5 to 10% of the cases that do not have a definitive diagnosis, just lay out the facts, and apply an abbreviated care plan and reassess earlier than you might have normally. And if we're not resolving or making improvement, then refer out. Either case, you're helping the patient down the right path. You don't truly grow your practice by just treating more patients. You grow your practice by making your diagnosis so crystal clear and understandable that patients commit to a specific tailored care plan and they follow through with it. They get it. They understand. And this is backed up by the literature as well. I'll show you a scientific study. When patients are shown their radiographs, they're happier, they're more confident, and they trust in the doctor. Everybody wins. Better outcomes lead to more referrals and more practice growth, especially when you explain the diagnosis gap up front. If you like videos like this, please click on the like button and subscribe to all the platforms that I post on. Thank you.